Greeting dear viewers, seputar info is back amidst your activity with us, Silmi, Nurul, Azmi, and Novitalia Haringga, who will bring you the latest and the most up-to-date news. A man from Indonesia experienced collapse lung and pleural effusion due to his smoking and vaping habits. Dr. Agus Wisusanto, a lung specialist from Persahabatan Lung Hospital, stated that the man came with complaints of persistent shortness of breath for 3 days and persistent cough. Based on his story, the patient had been smoking for 10 years. In the last year, he had been vaping with 50 puffs per day, which led to the condition known as hydropneumothorax or collapsed lung and pleural effusion. This condition occurs when there is both air and fluid in the pleural cavity, the space between the lung and the chest. After tube was inserted and the fluid was drained from his lung, the doctor advised that the patient to quit smoking and vape. The patient eventually stopped using vape and cigarettes, and there have been no complaints since. So vaping is suspected as direct causality, but it is still hypothesis, said the doctor who practiced at Persahabatan Lung Hospital in Jakarta. The next news, the latest study published in the Journal of Nuclear Medicine reveals that the vaping is more harmful to the lung compared to the conventional cigarettes. According to the study, vaping can cause lung inflammation and increase the risk of lung disease. Dr. Regan Wetterill from the Perelman School of Medicine at the University of Pennsylvania explained that the enzyme iNOS is overproduced in users of electronic and traditional cigarettes, which is associated with acute and chronic lung inflammation, or COPD, chronic obstructive pulmonary disease, refer to lung condition that leads to the breathing difficulties, such as emphysema and chronic bronchitis. The main symptoms of COPD, including worsening shortness of breath and chronic cough with mucus prediction, frequent chest infection, and a continuous wheezing. Let's switch to the next news, which will be delivered by my partner.
Thank you, Silmi. Many people believe that vaping and electronic cigarette can be used as alternatives to quite conventional smoking. Recent research has found that the use of vape can lead to a reduction in testicle size, inhibit sexual desire, and decrease sperm count. The research indicates that the fluid in electronic cigarette can increase oxidative stress and cause morphological change in the testicles. In previous study in Denmark in 2020, it was found that the men who regularly used electronic cigarette had a lower sperm count than those who did not use vape. However, this study states that more human data is needed to confirm these findings. This is important because many people consider vaping and electronic cigarette as alternatives to quite conventional smoking. Quieting addiction or habits can be a tiring process for most people, especially considering that electronic cigarettes are known to have a negative health effect. Dr. Semia Aziz, a general practitioner and television personality practicing in North London, shared his top 3 tips to quit vaping for good as reported by the Daily Mail on Thursday, September 14, 2023. First step is exercise. NHS doctors recommended exercise or staying active as a way to reduce the urge to vape. Developing distraction technique is also another way to tackle addiction. The second step is distract yourself. Aziz mentioned that the desire to vape often disappears after 1 to 2 minutes. This can be diverted by doing various household chores or listening to the music. Third step is manage stress. Many people engage in smoking or vaping habits to relieve stress. However, this can be replaced with healthier lifestyle choices such as meditation and outdoor activities, which are recommended alternatives by general practitioners. Let's remember that smoking is a very harmful habit to health. To maintain our own health and the health of those around us, it's important to consider quitting smoking or seeking help if needed. Thank you for being a part of our news today. I'm Novitalia Haringga and Silmi Nurul Azmi, bidding farewell and wishing everyone in Indonesia good health and well-being. Thank you.